Are you feeling really tired, having odd feelings in your hands and feet, or finding it hard to remember things? These might not be just small problems, they could be signs of a vitamin B12 deficiency. In today's video, we'll show you the top warning signs to look for and explain why this important vitamin is key for your health. Don't miss this important information that can help you stay healthy and avoid serious issues. Let's dive in and learn how to spot the signs before it's too late. Starting with number 10, fatigue and weakness. Feeling tired and weak can be a sign of low B12. B12 is needed to make red blood cells, which carry oxygen throughout your body. Without enough B12, your body makes fewer red blood cells, so less oxygen reaches your tissues and organs, causing fatigue and weakness. To help with this, try taking B12 supplements or eating more B12-rich foods like meat, fish, dairy, and fortified cereals. This can help your body make more red blood cells and boost your energy. If you still feel tired and weak after making these changes, it's a good idea to see a doctor for further advice and treatment. Let's move on to number 9, pale or jaundiced skin. Pale or yellow skin can be a sign of low B12. This can cause anemia, making your skin look pale. It can also raise bilirubin levels, making your skin and eyes look yellow. To help with this, eat more foods with B12 like meat, fish, dairy, and cereals with added B12. Talk to a doctor to see if you need B12 supplements to improve your skin and health. Before we continue to the next sign on our list, make sure to like this video and subscribe to the channel so you can get more health-related information through our videos. Number 8 on our list is nerve problems. Low B12 can cause nerve problems because B12 helps protect your nerves. Without enough B12, the covering around your nerves can get damaged. This can make your hands and feet feel tingly, numb, or like you have pins and needles. If not treated, it can get worse. To prevent this, see a doctor for B12 supplements and watch for these symptoms. This helps keep your nerves healthy and you feeling well. Bringing us to number 7, balance and coordination issues. Not getting enough B12 for a long time can cause balance and coordination problems because B12 helps keep your nerves healthy. Without enough B12, the protective layer around your nerves can get damaged. This makes it harder for nerves to send signals needed for balance and coordination. You might feel unsteady, have trouble walking, or be more likely to fall. This can make daily activities and life more difficult. To fix this, you should either eat more B12-rich foods like meat, fish, dairy, and fortified cereals, or take B12 supplements. Doing exercises, yoga, or physical therapy to improve balance and strength can also help. Number 6, we have memory loss and cognitive decline. Not getting enough B12 can lead to memory loss and thinking problems because B12 is important for brain health. B12 helps make chemicals that support nerve function and communication in the brain. Without enough B12, these processes can be affected, leading to memory issues, trouble focusing, and difficulty learning new things. To help with these problems, make sure you get enough B12 by eating foods like meat, fish, dairy, and fortified cereals, or by taking B12 supplements if your doctor suggests it. Also, doing brain-stimulating activities like puzzles, reading, or learning new things can support your brain health. Combining good nutrition with mental exercises can help keep your mind sharp and clear. Let's move on to number 5, shortness of breath and dizziness. Shortness of breath and dizziness can be signs of low B12 because it can cause anemia. B12 helps make red blood cells, which carry oxygen around your body. When you don't have enough B12, your body makes fewer red blood cells, so less oxygen gets to your tissues and organs. This can make you feel short of breath and dizzy. To help with these symptoms, eat more B12-rich foods like meat, fish, dairy, and fortified cereals, or take B12 supplements if needed. Also, see a doctor to check for anemia and get the right treatment. They can guide you on the right B12 dose and help manage your condition. Number 4 on our list is mood changes and depression. Mood changes and depression can be related to low B12 because it helps make important brain chemicals like serotonin and dopamine that control mood. Without enough B12, your body can't make these chemicals properly, which can lead to mood swings, depression, and irritability. To help with this, try to get more B12 from foods like meat, fish, dairy, and fortified cereals. or consider taking B12 supplements. If you have serious mood changes or depression, it's also important to talk to a healthcare provider. They can provide a thorough evaluation and offer treatment options to help with both your mood and overall mental health. Bringing us to number 3, glossitis and mouth ulcers. Glossitis and mouth ulcers can be uncomfortable signs of low B12. B12 helps keep the tissues in your mouth healthy. Without enough B12, your tongue can become inflamed, glossitis, and painful mouth ulcers can form, making it hard to eat or talk comfortably. To help with this, eat more B12-rich foods like meat, fish, and fortified cereals. Good oral hygiene, like brushing and flossing regularly, can also prevent more irritation. If the symptoms don't improve or get worse, see a doctor to check for B12 deficiency and get the right treatment. Let's move on to number 2, visual disturbances. Blurry or double vision can be signs of low B12, especially if it's been a problem for a while. B12 helps keep nerves, including the optic nerve that sends visual information to the brain. Without enough B12, the optic nerve can get damaged, leading to vision problems. To fix this, make sure you get enough B12 from foods like meat, fish, and fortified cereals, or through supplements. This can help maintain nerve health and might improve some vision issues. If you have ongoing vision problems, it's important to see an eye specialist. They can check your optic nerve and overall eye health to determine the extent of any damage and suggest the right treatment, which might include B12 supplements. Number 1, we have high homocysteine levels. High homocysteine levels can be a problem if you don't get enough B12, because B12 helps control this amino acid in your blood. B12, along with folate and vitamin B6, helps turn homocysteine into other substances. Without enough B12, homocysteine can build up, which is linked to a higher risk of heart disease and strokes. To manage high homocysteine levels, it's important to check them with regular blood tests. Eating foods high in B12, like meat, fish, dairy, and fortified cereals, can help keep homocysteine levels in check. If your levels are high, talking to a healthcare provider can help. They can give you advice on B12 supplements or other dietary changes to manage homocysteine and reduce heart disease risk. Thanks for watching our video on the top warning signs of vitamin B12 deficiency. We hope you found this information helpful and that it gave you a better understanding of how important B12 is for your health. If you're experiencing any of these symptoms, consider checking your B12 levels and talking to a healthcare provider for personalized advice. If you enjoyed this video and found it helpful, don't forget to give it a thumbs up, subscribe to our channel, and hit that notification bell so you never miss our future content. Share this video with anyone who might benefit from it, and leave your comments or questions below. We'd love to hear from you. Thanks again for tuning in, and we'll see you in the next video.